of my colleagues who research about aftercare program in Continuum of care for drug addiction. This is Tranjarak Khon Hospital. This is the main drug dependence center. This is tertiary level. Normally we have primary, secondary, and tertiary level of the hospital. This is the tertiary care hospital. Tranjarak Khon Hospital have 200 beds. It is non-profit government organization, and under the Ministry of Public Health, under the Department of Medical Services. This is the treatment program that we use evidence-based, and we apply CBT. MBT is main motivation enhancement therapy, case management, and therapeutic communities. And after finish the program, we implement at the national policy and develop expertise among the country. In information technology, we examine the knowledge management, monitoring the database, and we apply hospital information system in the hospital and accessibility. This is the workflow of the drug dependence center. After screen unit, we looking for yes or no. If yes in psychiatric comorbidity, we transfer to the psychiatric hospital. And then if the client doesn't have any psychiatric problem, we assess and diagnose in the three level. The first is low level, moderate, and high risk level is dependence. In the low risk and moderate, we give brief advice. We call brief advice, and here is brief intervention. Brief advice and brief intervention apply for the low risk and moderate, and then make the follow-ups at the OPD and discharge. OPD is mean outpatient department. Whereas the dependence case, we transfer to inpatient ward, inpatient department. The treatment unit will start from the detoxification, treatment, brief intervention, motivation, counseling, and MBT enhancement, therapy, CBT, 12-step, matrix, fast model, this is the special model of Khon therapeutic committee, and then rehabilitation program for self-help at the level of aftercare program for relapse prevention. This is the treatment system of Tranjarak Khon Hospital. We start the substance use or dependence, and then we treatment via the admit or inpatient department. We apply the motivation program to CBT and contingency management, and we apply Satya model too. Whereas alternative treatment, we apply alternative treatment program in our client. We use harm reduction clinic, yoga, acupuncture, social intervention, family therapies, spiritual therapy, and art therapy, including music therapy too. This is aftercare program. We monitor 1 year until 4 years. After they stay at the rehab is completed, they will allow to discharge from the institute, from the hospital, and together with orientation, the aftercare program. This is the team we visit in the community and family. Our aftercare program helps the client and keeps them from relapse on drugs and or alcohol in the future. The team will work side by side with client and their family to ensure that an effective aftercare plan is in place prior to their transition. You see, our team works side by side in the community and family. This plan often includes a suburb living environment and specific plan for participating in aftercare group and recovery support network, which may include 12-step meeting in the community, smart recovery with practitioners and volunteers. We try to capacity build among volunteers too. This is achievement that I would like to show. We developed CBT for substance use disorder. This is the memorandum of understanding among this institution and my department. I am the one who trained all of the practitioners and all of the medical doctors and nurses about the CBT applied for the chronic care model or continuum of care. We started phase 1 in 2013 until 2014 about the certified CBT therapists in country. We use 4 modules about the CBT therapists, and the phase 2 from 2014 until 2015 this year we developed of CBT for substance use therapists manual and patient handouts. And along this year too, we training course, training for the trainer, because we try to use the trainer develop the training in the region. This is the activities during develop CBT. This is my book that talk about CBT in Thai. And then this is a group during we start training, and this is a workshop along the day. And this is a training for primary hospital because the Tanjarak Drug Dependence Center is the tertiary care unit. So we concern the primary care unit. We training the primary hospital from the community until the secondary level. The secondary level is the community hospital is around 60 beds. This is the training for the physician or the practitioner. This is the president of the preventive medicine of Thailand. Then I and this guy developed addiction medicine in the country that try to educate the physician about the addiction studies. This is a training among village health volunteer. Right now, like Dr. Bang On said, we are finished the capacity building along the country already. And this is just to show about the concept of the continuum of care and aftercare program. The last one I'm going to show you here the video talk about the dependent center that I work in the region.
Hospital has a vision of becoming a leading center in addiction treatment and rehabilitation. We aim to achieve high standard care serving in Thailand and other ASEAN countries.
We provide medical services at the tertiary level or higher for patients suffering from drug abuse. The high quality of our services is regularly evaluated.
We train our medical staff the latest developments in treatment for dependency on psychoactive substance.
We conduct our research to improve the drug addiction treatment or policy concerning drug abuse. We advise authoritative bodies on its prevention and control and on the rehabilitation of drug addicts, both at the national and pan-Asian levels.
Angyanak Konken Hospital has an expertise at the tertiary level in drug addiction treatment and rehabilitation. Led by a team of experts from various fields, we treat medically complicated patients using our innovative and integrative approach. Accredited by the Healthcare Accreditation Institute, our hospital is at the front line of rehabilitation, engaging in a range of activities including treatment, research and development, knowledge transfer and quality control. On treatment, equipped with 200 inpatient beds, our hospital admits patients suffering from drug abuse into our program of treatment.